If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. This is our 12th season, and it's great to be with you today. As you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to become an informed patient, and we are here to bring you timely health discussions. Now, for those who are new to the show, there are two ways to get your questions in. First, you can call our live phone line at 718-499-6101. Now, secondly, we have a new thing this year where you can email us questions during the show, and you do that to askthedoctor@netny.net. And we're going to bring them into tonight's discussion. So if you have something that's burning or you want to comment on Dr. Saylor's hairdo or something, you call us on the email and we're going to talk to you about that. Now, for this episode, we have Dr. Terrence Sacchi, the Medical Director of Cardiology at New York Methodist Hospital. Next to him, I have Dr. Anthony Saylor, Pulmonary Attending at New York Methodist Hospital. Then we have Dr. Reginald Manning, Orthopedic Attending at New York Methodist Hospital. And welcome. And we have such a great show for you tonight. If I were home watching this, I would be thrilled. So you guys have a treat that, wait till you see this. Some guests you're going to recognize from the past and some new guests. But let's do in the news first so we can do our homework. Can't lose weight. Maybe you need to sleep on it. This was an interesting study that came out today, actually, that showed that people who sleep 5 hours a night or less have very difficult time dieting and actually start putting on weight. And it comes down to hormones. When you don't get enough sleep, the hormones that make you hungry become more, and the hormones that make you feel full become less. So you eat more and more. So no matter how you keep trying to diet and so on, you can't do it. So it's something very important. There's other things we talked about, sleep related to heart disease and others. Sleep is definitely related to gaining weight and to having difficulty getting those pounds off. Second big story, flu shot. The flu shot's here, but I'm here to talk about flu shots for mothers who are pregnant. A lot of women shy away from this. They think, oh, it's going to give me a miscarriage. I don't want to hurt my baby. Furthest thing from the truth. The baby, particularly between the months of 0 to 6, has no way to get protection because can't get a flu shot. But if the mother gets it while the baby is in the womb, the baby will be protected for those first 6 months. In addition, there's much fewer miscarriages for women who have gotten the flu shot because women are more prone to get the more serious infections. So please, they're out there now. If you're pregnant particularly, go out and get that shot. The next one worried me a little bit, and particularly for people who use the laptop. There's such a condition called laptop thigh. I don't know if anybody heard about that, or toasted skin syndrome. And what happens is they put the laptop on the thighs, and if it's like a girl with a dress or something, it's even worse if it's directly on the skin, and the skin becomes discolored. It becomes brown and sometimes gets all irritated. It usually goes away on its own, but it's something you may want some protection. You don't put it directly on the skin. Try and keep it on a table because it's not a pleasant thing, and it gets people bent out of shape, particularly the color. Now, fatty thighs are good. What does that mean? Well, it means that fat that accumulates around the thighs is actually protective against diseases such as diabetes and heart disease. So what we think if a woman has or a man has big thighs with fat, you think, oh, that's bad. No, that's the good fat. The bad fat is the kind that accumulates around the belly. So the trick is to figure out how to get the fat to accumulate around the thighs and why in some people it does and others it doesn't. But at least we know now that not all fat is created equal, and there's hope that by rearranging the fat that we can actually make people who are obese skinny again just by changing it. So it's an interesting thing. Now our new section is Myths of the Week, and here we try to debunk some of the myths that are prevalent in the community. Now here's one that I can think a lot of kids and adults are going to relate to this. It's best to cut the crust of the bread off before giving it to your children. I don't know. Reggie, your mother used to cut that crust off and give you little cucumber sandwiches?
I don't believe so. I had to eat it all.
You ate it all?
Yes, sir.
And she did the right thing because in that crust, because of the baking process, there's cancer-fighting antioxidants 8 times higher than in the rest of the bread. So the key is, number one, eat as much whole wheat bread as you can, but don't avoid that crust because you're losing the best part of the bread, the most healthy part. Now, number 2, how many of you heard this? Dr. Saylor, don't go swimming. You just had a meal, you're going to drown, right? Everyone's telling you this. Turns out that's totally false. In theory, it had a good theory that if the blood, after you've eaten, all the blood goes to the digestive tract to help digest the food and away from the muscles. So when you'd exercise by swimming, the muscles wouldn't get enough blood. It makes a lot of sense. Unfortunately, it doesn't happen. Not true. You can go in swimming, even eating. While you're eating, go in swimming. So don't worry about that. Now here's one. An apple a day, does it keep the doctor away? And then, you know, we do a tremendous amount of research here, and we went back to the books. And in 1800, this phrase originated. And this is the way it went. It's a Pembrokeshire proverb, whatever that is, somewhere in Wales. Eat an apple a day, eat an apple on going to bed, and you'll keep the doctor from earning his bread. This is Obama wrote this. No, but this is, he made, eat it. So the whole point then was to keep the doctor away, that you shouldn't have to pay him. Turns out, though, that apple is not the best fruit to have if you can eat something a day. Blueberries would actually be better, but there is no one food that makes you healthy. So the trick is to eat your 5 and 6 servings of vegetables and fruit a day, exercise, get enough sleep, and that's the best thing to keep the doctor away. Okay, now what about to get rid of hiccups, Dr. Saki? Do you have to have someone startle you?
That's what used to happen to me.
Well, turns out, never been proven, and in 1971, the prestigious New England Journal of Medicine did a study and found that the only thing that helped out of all these remedies was putting a teaspoon of white granulated sugar in your mouth when you have the hiccups, and it'll stop them. And not sure why, if that stops you from breathing in and out, from resting, taking your mind off of it, but that's a good trick. So if you got the hiccups, and hiccups may be a sign of underlying heart disease, so I'd avoid startling anyone because you may stop the hiccups, but also the breathing. So watch out for that. Now, finally, warm milk. Will it help you to fall asleep? You know, your mother says, here, drink this warm milk, you'll relax, you'll go to sleep. Well, warm milk has the same chemical that turkey has that supposedly makes you sleepy, called tryptophan. Unfortunately, it has so little that you'd have to drink about 20 gallons of milk to get enough of this chemical to make you feel sleepy. So in getting enough sleep, getting to sleep, get a routine going, keep the kids quiet before they go into sleep, no caffeine, no exercise, and that's the best way. I got to mention Monsignor Bennett missed one show in our 12 seasons. Monsignor, it's great to see you here. You know Monsignor
I do very
Bennett?
well.
So,
it's a pleasure to see him.
thank you. And now the quiz. I know everybody's at home with the book, with the almanac out. This is the quiz. We think it's particularly difficult this week. What is the most common street name in the United States? What is the most common street name in the United States? Well, we're going to take a short break now, and when we come back, we're going to go to your phones. So the number to call is 718-499-6101. Now our topics, cardiology, pulmonary medicine, and orthopedics. And remember, you can email us. Don't forget, askthedoctor@netny.net. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to Ask the Doctor, where our topics are cardiology, lung disease, and orthopedics. Now let's meet the stellar panel. First we have Dr. Terry Saki, cardiologist, and it's great to have you back. You were on about 5 years ago?
Yes, Steve, that's right.
Now, if something comes to mind, like something that's really groundbreaking in the last year or two in cardiology, what would you say?
Yeah, I think the biggest issue is that all the initiatives that have been undertaken over the last several years are beginning to pay off, that there's a decrease in mortality, people are living longer, and I think a lot of it has to do with shows like this and the education that people are receiving and taking action on. So we're encouraged by what's been happening in the last several years.
This is good, and we're going to get to all the one of the finest cardiologists you'll ever meet. So you have problems with your blood pressure, with irregular heartbeat, congestive heart failure, heart attacks. This is the man to call. We look forward to having you with us again in the future, and thanks for coming in tonight.
Thank you very much.
And Dr. Anthony Saylor, if we roll back the tapes, he was on in our, I think it was the 8th season, because now we do seasons in weeks here now, but if you go back to our 8th season, you hear Dr. Saylor discussing the Yankees and the Mets. Unfortunately, his prediction came true with the Mets, and with the Yankees, they'd be in the playoffs. I'm a little concerned as a Yankee fan with this going out to Minnesota. What's the story?
I'm pretty confident. I think if Sabathia gets the first game, we'll be okay.
So I need a prediction so when we roll this back, actually, we'll see how we did. How many games?
I think Dr. Saki and I agreed Yankees in 4.
Yankees in 4. Okay. So we got that on tape, and when we come back next week, we'll see. As they say, God willing. God willing.
God willing.
On this show, God willing more. Okay. And now we'll go to Dr. Reggie Manning, orthopedist, always gone as a tremendous number of calls. And he has something earth-shattering in his life, actually. Right?
And my wife retired.
Ooh.
My daughter got a new job, so everybody's happy. And I'm still working.
This man goes out every day. She keeps saying, "Get out of there, get out of there." But she got the quiz last time, if I recall.
Yes, she did. She surprised me.
So see if she gets it tonight. And did she give you any errands to pick up on the way home?
No, sir.
Very good. Okay. So that's it. So this is our panel. Now let's see who could that first caller be. Could it be Maddie? Could it be Joel? Could it be Grace? Who knows? Let's see. Hello. Who is this, please?
Madeline Mara.
It is Maddie Mara. Hi, Maddie.
Hi.
How you doing?
I'm doing.
See that extra 7-second delays throws you off.
All right.
Maddie?
I'm.
Maddie, so what can we do for you tonight?
My sister had the shingles last year, and now she complains that her backbone hurts her.
Okay, and what did she have last year?
Shingles.
Oh, shingles. Okay, that's a good one. I'm going to turn to Dr. Saylor for shingles, one of the most painful injuries known to man, right?
Sure. Well, Maddie, shingles can be a very painful condition. And as a matter of fact, in many instances, the pain can last anywhere from 3 to 6 months. So I think if the pain is really a problem, you can try a pain specialist. Some of these pain management specialists may be able to inject the skin and hopefully help the pain. So if she's having a lot of pain, that's something I would recommend.
Thank you, Doc.
Maddie, it's great to hear from you.
Yeah, thank you.
And I hope you feel better.
Yeah, thank you.
Take care. We're now going to go to Larry. This may be our longest distance caller. Larry, is this Larry from Rockland County?
That's right, Dr. Garner. How are you?
Hi, how are you tonight?
Okay, I guess. I had a question for Dr. Saki, if I could address it, about atrial fibrillation. I was taken to the hospital on Friday, and they spoke about, ablation, cardiac inversion, blood thinners. Must have been a half a dozen different things that were presented to me, none of which I cared for. And after 2 days, when my heart settled down, I went home. They offered me also a stress test. I don't know what the stress test would tell, but they did an echocardiogram, I guess, and everything was fine. I'd like to know what causes it, and if there is any specific treatment for it. They told me it was electrical, and I know I pay my bill every month, so I'm really not sure that's the problem.
Let's see what Dr. Saki thinks. First of all, for the audience, can you just brief description of atrial fibrillation, and then for the patient?
Surely. Atrial fibrillation is probably the most common rhythm disturbance that patients have, particularly adult patients. And really, in essence, what happens is that the heart usually beats in synchrony from the top to the bottom. At times, the upper chamber kind of goes on its own and will beat out of sync with the bottom of the heart. It's a very common arrhythmia, and people can live forever with it. The approach is somewhat complicated in trying to decide who needs to be treated. But certainly, if you converted and you're back to normal, Larry, I would suggest that you take a cautious approach. The fact that your echocardiogram was normal would suggest that this might be something that will never happen again. But if it does, I would not consider anticoagulation with Coumadin at this point. However, I would follow up with your physician and see what the natural history of this problem will be.
When you say natural history, I did have a heart surgery about 4 years ago, but I've never had any incident like this at all. And they gave me a medication when they were taking me to the hospital, Carda something, or Carda's.
A beta blocker or
right,
an alpha.
Cardizem. Cardizem is a medication to control the rate of the heart. It's very important when this occurs that the rate is controlled. And there are a number of medications to do that. The medications to maintain the rhythm in the normal beating is less secure and is less successful. So I think this requires a dialogue between you and your healthcare provider, but something that can be easily managed and should not be a major issue for you as long as that you're aware of it and are being followed by your physician.
Is a nuclear stress test in order for something like this, or is it? I'm a diabetic also, and I don't want to start putting dyes into my kidneys.
Well, the nuclear stress test does not involve any dye, but it may not be necessary. It really depends on what your physicians are looking for. It might be part of the workup, but many times it's not.
So what I get, just to summarize, not that serious as far as life-threatening, something that can be treated many different ways, requires a dialogue with the doctor to figure out what's best for you.
Absolutely, I think that's
but it's a hope. It's a hope.
It's a hope, and people
Right,
live with this for 100 years without any major problems.
I appreciate that.
Can you call us up, Larry, next week and give us a follow-up?
Okay, I'll keep you posted, and the best to everybody there.
Thanks a lot. We now have somebody who might have won the quiz, thinks he won the quiz. Margaret? Is this Margaret?
Yes, it is.
Margaret, there's a rumor around here that you may know the answer to the quiz.
Oh, Main Street?
Well, I got to throw that to the judges. Judges, is it Main Street? Oh, you know, this is not good for the heart, I'll tell you. You had me so excited. I thought you had it. But you can try again if you come up with another answer later on in the show.
Okay.
Okay, do you have a question?
Can I ask you one question?
Sure.
Why do so many people die in the bathroom?
Why do so many people die in the bathroom?
Either a heart attack or a stroke.
Why are they more prevalent in the bathroom?
Right.
Part of the reason might be it has to do with autonomic dysfunction, which has to do with the nervous system, which controls different areas of the body. And sometimes different functions that are occurring in the bathroom can precipitate swings of the autonomic nervous system, and that might be one explanation.
Is straining is bad?
Straining is one of those maneuvers that could cause that, yes.
So it's important to try and be regular and keep the stool soft because...
Right.
Absolutely.
Is that an answer in trivia, the most common
Some of my friends, like they fall.
I'm not sure about that.
Okay. Margaret, be well.
Okay, thank you.
Take care. Bye. We're going to another Larry now. Hi, Larry.
Yes, hello?
Hi, where are you calling from?
Brooklyn.
Which part?
Oh, that's...
The questions get harder, so... Where's that? Okay, he's shy. He doesn't want to... Larry?
Yes, I'm here.
Where are you calling from? Which part?
I'm calling from Brooklyn, New York.
Very good. Let me ask you a question, because we were trying to find a diner the other day. Found the Kings Plaza Diner, which I loved. What's your favorite? Do you have a favorite diner in Brooklyn?
Well, I try not to eat in diners anymore.
Why?
Well, because of the type of food that's served.
They do serve a lot, I noticed, yeah. All right, what can we do for you?
Yes, my question is this. It's funny, it's almost a follow-up question to what the first gentleman was just discussing. My question is, I did have the ablation of the heart. And they went in, they singed the heart to correct the electrical system. And what happened thereafter is I did get it again.
Oh.
And they then put me on a Tylenol and high blood pressure medication, and that seems to keep it under control. Now, does the ablation of the heart in any way damage the heart?
Well, we're putting Dr. Sacchi to work tonight here. Yeah.
Well, in essence, it does damage the heart, but it's in a controlled way. It has no long-term effect. But if this was done for atrial fibrillation, the ablation technique is very common, but it does have a success rate depending on the rhythm that might be involved. Atrial fibrillation is the last frontier of ablation, and now the success rate is about 50%. So that I think you have to expect the fact that this is not unexpected, and that the medical therapy is now the next step. So that there are some rhythms where ablation is 95% effective. but atrial fibrillation, as I said, is about 50%.
So it sounds like, does he go again, or does he try?
My advice, without knowing the case, would be to not to do it right now and see how the medical therapy takes care of the problem.
Larry, give us a follow-up too on that. Thanks a lot. We'll go to Carol now. Hi, Carol. Carol? I don't see Carol. Carol? Okay.
Hello?
Hi, Carol.
Who's this?
Who are you looking for?
Who?
See, I get wrong numbers. Who gets wrong numbers in a TV show? Carol, can you turn down your TV set? And then we're going to come back to you, okay? Okay, we're going to go now to an email question while we're waiting for Carol to get straightened out here. This is the question. Again, another cardiology one here. I have a mitral valve problem, a prolapse. A mitral valve prolapse, and the doctor tells me I'm going to need surgery to repair the valve. I don't understand why he wants to operate so soon. What do you think about mitral valve prolapse and aggressive treatment?
Well, mitral valve prolapse is a very, very common problem. And actually, very few patients need mitral valve replacement. So I think that there should be a lot of discussion with your physician as to why this is being recommended now. The prolapse itself is not the issue. It's the leak that occurs at times with the mitral valve. And if that is severe enough and has been there long enough, then surgery might be an option. But in general, in my experience and in most people's experience, mitral valve prolapse resulting in surgery is rather infrequent.
So I hope that helps you. And now let's see if Carol's ready again. See what's going on. Carol? No, it sounds like Carol's not going to be with us right now, but we're going to go to Lorna, who's with us. Hi, Lorna. Lorna? This is interesting. Lorna. Okay. In the meantime, let's get to Dr. Manning, because I do have some questions. Yes, sir. Dr. Manning, tell us about some of the new knee surgeries that you're doing.
There are new developments in ACL surgery, anterior cruciate ligament, where instead of putting one graft, then they do double bundles. They think that's more physiologic. Obviously, it's much more difficult. And I'm not sure it's worth all the trial yet, but they're trying to recreate the anatomy, and that's becoming the new gold standard. But it's not practiced all the way across the country just yet. It's starting in the big centers, then it'll filter its way down.
How much time? You're going for a knee repair, let's say, I don't know, you hear these baseball players, they're out till the following season for an ACL, or give us an idea of some of the different
ACL
surgeries.
Is major recovery. The surgery itself is not that dramatic. You're just basically putting a new piece of tissue in to replace the one that's damaged. But there's a lot of damage that goes along in terms of the inflammation, a lot of weakness and stiffness has to be overcome. So realistically, it's a season-ending surgery, and we talk about sometimes 9 months to a year for the rehabilitation to get to the high level of athletics.
Does everybody need one? Let's say I'm out at a weekend warrior, I'm playing, and I feel a little pop.
Absolutely not. Other options include bracing, depending on the sport. And some people are willing to adapt their knee to adapt their lifestyle to their knee, but not willing to go through any major operation. And in that high demand, people playing rapid change of direction sports, such as tennis, basketball, soccer, things like that. You could probably function well without an ACL.
Interesting. Good. We have somebody on line 3. And okay, I don't want to interrupt you. Hi, Dinah?
Yes.
Hi, Dinah. How are you?
Okay, thank you.
Where are you calling us from?
From Bensonhurst.
Bensonhurst. There's some nice diners in Bensonhurst, isn't there? Aren't there? What's that diner on 86th Street?
Vegas.
Vegas Diner. That's nice. Yeah. What do you like to eat in there?
Yes, we go there quite often, but there's a nice one called Bridgeview Diner on 3rd Avenue in Brooklyn, 91st Street and 3rd Avenue.
Dr. Sale is nodding that in agreement. He likes that one too. So
Right.
What can we do for you?
Okay, I recently had cataract removed from my right eye, and I can see, when I close my left eye, I can see all of you beautifully, but there's still like a film in front of my eye, and it's getting better each day. But why is it that some people can see right away and other people have a different problem like I'm having?
Yeah, what does your doctor say?
Well, he has, he says that some people can see right away, but other people have to wait 2 or 3 weeks. And it should get better. And I'm putting drops in my eyes now. But why is it that some people can see right away and other people have a problem?
You see, it's one of those things that everybody's different. Like we were saying, some people eat fatty foods and they don't get fat, others do. And it's most likely a part of your normal. Dr. Saylor, any thoughts on that? No. You didn't pay for 50% off, did you? Because that's another reason that sometimes. But where did you have the surgery done?
I had it at the Brook Plaza Clinic on Avenue K in Mill Basin.
Very good. No, that should be fine. You should start seeing. I wouldn't worry about it.
All right. Thank you so much for your help.
Okay, feel better.
Okay, thank you so much.
Take care. We have Tom. Tom?
Yes.
It's possible you have the answer to the quiz I heard?
Yes. Is it Broadway?
Broadway. Let me ask the judges. Tom, I feel for you.
Okay.
What was what? It's a good thought, though. Actually, a number of people on the panel guessed that tonight. Main Street and Broadway. But it's not it. So we'll keep trying.
Okay, thank you.
Take care, Tom. Let's now Robert now. Robert.
Yes.
How are you tonight?
I'm okay, buddy. How are you?
Okay, now, where are you calling us from?
I'm calling from East New York.
East New York, and you think you have the answer?
Yeah, I also thought it was Broadway.
You want to take another guess just as you're on the line?
Sure.
Don't guess Linden Boulevard.
What about Delancey? Delancey's
Delancey
famous.
Street judges. I'm sorry. I'm sorry, but what's going on in East New York?
Nothing much. There's a lot of rebuilding going on in East New York.
I'm always looking for restaurants in East New York. I never hear one. I was talking to Marie early this morning. She told me there's no good restaurants around. Is that true?
Yeah, that's absolutely true. We usually travel out to the city to go have good meals. In East New York, not too much.
They should do something about that. Where's your favorite place in the city?
I like going to Katz.
Katz's?
Yes.
Oh, you know, with all the salamis in the window? That's a great place.
Oh, there you go.
You could actually send one to your servicemen.
Really?
Yeah, that's weird seeing a salami in a rack. That's something you don't usually see. But anyway, it's great to hear from you.
Wait. I have a question for the lung disease guy. I have a question for him.
He's right here, Dr. Saylor.
Yeah, Dr. Stella. Hello?
Hi.
Yeah, Dr. Stella, I want to ask you a question. I want to know if smoking marijuana or the bamboo paper will give you lung disease. And if it does, why would they prescribe it as miracle marijuana?
Okay, that's really a very good question, especially with some people trying to legalize marijuana. Marijuana is very bad for the lungs. You should know that it can cause every bit as much trouble in the lungs as cigarette smoke, and in many instances, prolonged use can cause worse lung problems than cigarettes themselves. The medical marijuana that they prescribe is in a very low dose. It's very limited. And if you look around the country, California, they do it, a few other areas, but it's not really widely utilized. So marijuana is as bad, if not worse, for the lungs as cigarette smoke.
Interesting.
But, but I have to be honest with you, Doc. I have known people who have smoked marijuana for like almost 30 years, and they never died of lung disease. They wasn't even diagnosed. And I'm not talking about just one or two individuals. I'm talking about many individuals that I know. Sure. And in fact, I'm not sure if I'm correct, but I don't think anyone ever died from smoking marijuana. I mean, I'm not 100% sure, but I still haven't heard a case.
You know, that's a good point, and let me just answer you that. You've been fortunate, and the people that you know have been very fortunate. We had about a year ago a 20-year-old girl who was in college who smoked marijuana and ended up on a ventilator for about a month. Wow. Her lung collapsed, and she almost died. So the people that you know may have been fortunate, but I still am going to be very dogmatic in telling you marijuana is very bad for the lungs.
You know what?
Yeah, I got you, Doc. Thank you.
Take care.
You're
be
welcome.
well.
Good luck.
We're going to take a short break, but before we go to the break, I want to ask Dr. Manning, why are so many older people breaking their hips?
There's a question of the chicken and the egg. Does it break and then you fall, or do you fall and then it breaks? As we age, our vision goes, our balance goes, our coordination goes, so we all fall. Unfortunately, as we age, we tend to get osteopenia or decreased bone density. And no one knows exactly when the hip fractures, but decreased bone mass and the stress of falling does lead to fractures, not only hips, but wrists, shoulders, ankles as well.
Can taking medication prevent it?
The only thing that can prevent it probably is falling. Medication can strengthen your bones, but if you have more stress than the bone can handle, it's going to fracture no matter what you do.
Okay. So let's take a short break now. When we come back, we're going to talk about cardiology, lung disease, and orthopedics. The number to call is 718-499-6101, and the email is askthedoctor@netny.net. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to Ask the Doctor, where our topics are cardiology, lung disease, and orthopedics. With me I have Dr. Terence Sacchi, a cardiologist, Dr. Anthony Saylor, lung specialist, and Dr. Reginald Manning, orthopedist. Now, let's get to our questions. I can't believe this phone lines are going crazy tonight, so we're going to try and speed things up a little bit so we can get to everyone. Let's see, first of all, about Joseph. Hi, Joseph.
Yes, Dr. Gardner.
Where are you calling us from, Joseph?
Yeah, Queens, Doctor.
Which part?
Sunnyside, Queens.
Sunnyside. Nice. Any diners out there?
Yes, a lot of.
What's your favorite?
Okay, Sidetracks on Queens Boulevard, 46th Street.
Yes.
Yes, great diner.
What about the Georgia Diner?
And if you like a glass of Guinness Stout, it's great there.
Really?
Yes.
And just say it again, the name?
Sidetracks.
Sidetracks. We have to head out there.
I do. On 46th Street, right off the number 7 train.
Thanks a lot for the tip.
Yes, sir.
How you feeling?
Very good.
What can we do for you?
Yeah, 2 questions. Well, 1 question actually. I have. I'm supposed to get a stent in up close to my heart. A stent. You understand?
Yes. How old are you?
I'm. Let me see. 60. I'm going to be 67.
67. Okay.
Yes. Okay. So I have this pending, and also, what I have is I have a carotid artery blockage, but it's 50%. But my cardiologist said maybe they could do the two procedures, together. So
okay, let's go to Dr. Sacchi. Can they do a cardiac stent and a stent in the neck at the same time?
I would not recommend doing both at the same time. Clearly, the cardiac stent is very commonplace. Putting a stent into the coronary arteries has been around for a number of years now. The technique is rather straightforward, depending on the type of blockage that you have, but it should be the first thing that I would do, perhaps. The carotid, though, requires a little bit more, and certainly I would never do both at one sitting. I think that would be a mistake.
And one other quick question. Is 50%, we'd have to know a little bit more, because that wouldn't necessarily mean a stent should be put in, yeah?
Right. 50% in the carotid artery, unless it was a complicated lesion, would be by itself something that you would not want to intervene on. However, there needs to be more data, and there may be some other issues that we're not aware of.
Joseph, thank you so much for the tip, and hope you do well. Give us a call back.
Yeah, can I have one more fast question, please?
Quick.
Yeah, it seems like I'm a wreck, but anyway, I have a problem with my prostate too, and my number now is 4.2. And I've been hearing a lot of different debates and questions and concerns, and not the right. I don't know what do you think would be the right procedure? It has been going up steadily,
See, I'm going to turn you over to Dr. Manning, who's probably going to want to answer your question about what it was last year.
Thank you very much.
You probably might need a biopsy if it's going up. That's the only way you know if you have any cancer, if it's just benign hypertrophy or growth. So at some point, if the numbers are going up, you may need a biopsy, which can be done in an office. I had it done not too long ago.
Really?
Yeah.
Painful?
No.
So go and get that biopsy, okay? But don't do it on the same day as the stent and the, it comes one-stop shopping, this guy. Joseph?
Okay.
Be well.
Thank you very much. Thank you for your help, and thanks for all your help, Doctor.
Thank you. Go to Jim now. Hi, Jim.
Good evening, Doctor.
Where are you calling us from?
I'm calling you from Maspeth, Queens.
Maspeth. Any tips out there for the diner?
Yeah, there's a diner on Grand Avenue and 69th Street, Fame Diner. It's very good.
Jane?
Fame.
Sane. How is that pronounced? Sane?
F-A-M-E. Fame.
F-A-M. Oh, the Fame Diner.
Like famous,
Right.
yeah.
Yeah, there used to be one on Union Turnpike. Okay.
I don't know.
What can we do for you?
They may be connected. I have a cardiology question, but before I ask it, Doctor, I want to thank you very much for all the good work that you do with this show and with your website. It's really great, and I just wanted to commend you.
Appreciate it. Thanks a lot.
I'm on a medicine called Plavix. I'm sure you've heard of it.
Yes,
I had
Plavix.
2 stents placed last year, and at the time, my cardiologist recommended that I stay on the Plavix for at least 3 years. But now my primary care physician is recommending, because I'm at the age, and recommending a colonoscopy. But they don't want to do the colonoscopy unless I come off the Plavix. So,
all right, let's get to Dr. Sacchi on that Plavix, why it's used, and should he be off for colonoscopy?
Well, certainly after a stent, a Plavix should be used. One question that I would have for you is, was it a drug-coated stent?
One of them was and one of them wasn't.
Well, that being the case, then you should be on the Plavix for at least 1 year. If this was an elective colonoscopy, I would postpone it until you got through that 1 year. After that, really anything can be done. And even if you're in the middle of it and you really needed it, it would be a matter of just stopping the Plavix for 5 days and then getting the procedure done and resuming it. But if it's been over a year, I think you're safe.
So it sounds like not a big deal on that.
No,
okay,
it's very commonplace.
It's been close. It's been 10 months, so I have 2 more months to go.
Right. If it's elective, it's just a screening colonoscopy. Frankly, I would wait the 2 more months and then go ahead and get it done.
Thanks, Jim. Appreciate it.
And also, can I answer the question?
You have an answer? You sure? What is it?
Is it Park Avenue?
Is it Park Avenue, judges? I'm sorry.
All right. Thanks a lot.
You have to stay on Plavix another month now. I'm sorry. Take care. Take care. Be well. I see an email answer to the quiz. We got to give them a fair chance here. Alan Minsky sends in Washington Avenue. Judges, is it Washington Avenue? Oh, my God. I have to give a hint because, you don't want to be sadistic here. People are calling in and are in earnest. I'm going to give you a hint. It's a numbered street, believe it or not. A numbered street. Okay? Let's see if that helps out there. And now we're going to go to Vicky, who's been waiting patiently. Hi, Vicky.
Hi.
Where are you calling us from, Vicky?
I'm calling from Brooklyn.
Which part?
By Brooklyn College.
Oh, any diners out there?
Applebee's.
Applebee's. That diner? What would you call that, a diner?
A little restaurant.
There's a Floridian diner. Isn't that not too far? Floridian?
Yeah.
You know that one sort of in the middle on Flatbush Avenue?
But yeah, Flatbush and Nostrand.
Yes, yes. Very good. So what can we do for you tonight?
I have a question for Dr. Manning.
Oh, good. I mean, we brought him here. We want him to get some questions. Good.
I was jogging the other day, and I think I'm not sure if I pulled an hamstring, but
you have the TV on. It's confusing you. Turn the TV off.
Okay. The thing is, I don't know. My knee is swollen. The back of the knee is swollen. They did X-rays in a hospital, but they said nothing was broken. But my calf hurts. It's swollen, and I have a pool going all the way up to my knees, and I can bend my knees. I don't know what to do.
May I ask how old you are?
Early 30s, early 40s, actually.
And do you run fairly regularly?
Yes.
And do you stretch before you run and warm up?
No, I don't.
Big mistake. That's probably why you injured the hamstring. You should do a lot of warming up, then stretching before you run, and cool down afterwards. In terms of the swelling behind the knee, you may have developed what we call a Baker's cyst, which can be a sign of inflammation. The only way you can diagnose that is with an MRI. It won't show up on a plain X-ray. So usually for hamstring strains, some anti-inflammatory medicine and maybe some therapy for stretching, then you can resume running when you feel more comfortable.
Like what medication do I take?
Something for inflammation. If you could take the non-steroidals like Aleve is twice a day, if you can tolerate that. That's probably where I'd start.
Thank you. Thank you very much for the question, and feel well.
Thank you. Thank you very much. I appreciate it.
Be well. And I see we have a comment now in our emails, if you check that out, that Alan Minsky writes, maybe the guy has an electrolyte imbalance since the problem is with the heart's system. How about prescribing Pedialyte or Gatorade and checking the blood for electrolyte imbalance, which we're glad Alan is not a doctor. So don't do that. But Dr. Sacchi?
Certainly, electrolytes can precipitate or be part of a problem of atrial fibrillation. However, that is usually routinely checked, and there are better ways and different ways of correcting it more exactly. The biggest usually is a potassium or a magnesium issue.
So we hope that that helps you. And now we're going to go to Joe on line 2. Hi, Joe.
Hi, how are you?
Joe, where are you calling us from?
Howard Beach, Queens.
In Queens. What's out there? Now, in Howard Beach, any good there must be a good diner out there.
Yeah, we have plenty of good diners out there. There's good Italian restaurants out there, too.
You ever go to Frank Russo's place?
Of course. I work there.
That's a great place. We're good friends with Frank. He's a good friend of the show. Actually, we're going out there in a while next month. He opened up a place across the street?
Down the block.
What's the name of that?
Vito.
Yeah. Nice place. What can we do for you?
I had a question. I was an intravenous drug user when I was younger, and I was put on methadone. And now that I take this methadone, it hurts my heart. And I just wondering, like, is it doing anything bad to me?
Methadone is hurting your heart. What, are you feeling pains?
Yeah, I have like chest pain.
Okay.
Methadone per se should not affect the heart. What I might be more concerned about is what's happening to your blood pressure, and are you smoking? Or is there something else that you're doing that might be contributing to that? But methadone per se, in the appropriate doses, does not cause any specific heart issues.
So that's good news.
All right. Well, I do smoke. I am
Dr.
overweight.
Saylor?
Well, you know that smoking, how many bad medical issues it causes, so please do your best to stop smoking. Your whole health will be so much better, so please try to stop.
All right, guys.
Thanks.
Thank you.
And I wanted to ask Dr. Saylor, winter's coming on. What should people be doing? You know, let's say I'm out there, I'm 65 years old, my wife and I want to know, how do we prepare for the winter?
Well, I think much as during the summer months, a healthy mix of exercise, eating right, not smoking. A lot of people feel that in the winter they shouldn't exercise. That's not correct. As long as you bundle up well and are protected, exercise actually is very good to do during the winter.
What do you think about, should they get a pneumonia shot, a flu shot? What should they do?
Good. Well, a flu shot certainly anybody over 65 should get. And anybody who has medical conditions, heart disease, lung disease, diabetes, should get a pneumonia shot every 5 years.
Every 5?
Every 5 now, yes.
Any of you guys recommending the shingles vaccine that prevents shingles? Is that or not proven yet? Not enough. So that question about the shingles that we had really wouldn't protect it, mostly. Very good. Okay, let's go to now Lorna. Hi, Lorna.
Yeah.
How are you doing?
I'm all right, Doc.
I want you to speak nice and loud because we're having it's low, the system here, so I want to make sure I hear you. Where are you calling us from?
I'm calling from Brooklyn.
Which part?
In Crown Heights.
Where's that? Carlisle?
Crown Heights.
Oh, Crown Heights. I thought the hotel. That got me confused. Crown Heights. Very nice. Is there any diner in Crown Heights?
I really am not fond of the diners. I really don't eat at the diners, so I couldn't recommend one.
So when you cook a meal in your house, you want to impress someone, what would it be?
Oh, I'm Jamaican, so I cook rice and peas.
Rice and peas?
Yeah, and chicken.
What about a little some meat there? What?
Chicken, mostly, and fish.
Chicken and fish?
Mm-hmm.
Where do you live?
With I live in Brooklyn.
Could you take the 4 of us?
Oh, boy, oh, boy.
No, okay. All right, we'll hold off for now. What can we do for you?
Yeah. I have some numbness and some tingling in my fingers and my toes after a surgery. I just did a surgery. And it's the same one that I have the IV. I was given the IV in. Well, I'm concerned about if it could lead to a stroke or anything. I do have an appointment to see a neurology, but I'm kind of concerned about it.
Let's see what Dr. Manning thinks about these tingling in the fingers.
Do you have diabetes?
Yes, I do.
Because you can get peripheral neuropathy or nerve inflammation from diabetes. And classically, it's a stocking and glove distribution where it gets the hands and the fingers. It may be just as simple as that, but I would go for the neurologist and get the workup, either confirm or come up with another diagnosis.
But
Okay.
so not necessarily she has to be worried, but she needs to get it worked up.
Needs to complete the workup, yes.
All right. Thank you
I want
so
to
much.
thank you.
Doctor.
Now we're going to see if we can speed up. This is a hard group to speed up. Mira.
Yes.
Mira, hi. That's a nice name. What does it mean? Does that have any meaning, any significance?
It's Mila. It's I came from Russia a long time ago.
Wow.
Uh-huh.
Very nice. Very nice. Where are you calling us from?
Calling from Brooklyn, New York.
And what do you like to eat? How about the Russian restaurants like Tatiana or Rasputin?
No, not there. I live in Borough Park
Oh, okay.
or Hamilton.
There's some diners out there.
A lot of them.
Yeah. What can we do for you?
I have a question for orthopedic doctor.
Okay.
I'm not a good speaker, in English.
No, you're doing very well. What's the question?
The thing is, I'm the patient diagnosed lymphoma a few years ago.
Diagnosed with lymphoma.
Yeah, B-cell large lymphoma.
How old are you?
I'm 55.
Okay.
After that chemos, I got well, but my bones are all over. And especially under the ribs on the right side. The doctors gave me MRI, some CAT scan, and X-rays. They can't help me out with what's going on with my bones.
So this is Mira. This is it's a tough question. People treated. You got better from the lymphoma, now has bone pain. I mean, we always like second, third opinions we talk about on the panel. Anybody want to talk?
Well, your lymphoma is a disease of your blood-forming cells, which form in the marrow of bone. So maybe that might be part of the issue. I'm not a specialist in the cancer treatments and things of that nature, but the marrow is where the lymph cells and other blood cells are formed, and you do have that in the ribs as well. That may be part of the issue. Aside from that, I'm not sure I can give you much more information.
There are many excellent cancer centers around. I know we have one at the New York Methodist Hospital, excellent cancer center. It's a good idea to get a second opinion.
Sloan.
At Sloan Kettering, which is one of the best.
Yeah, the best is the best, but they can't help me. They don't know what it is.
Why don't you give me a call tomorrow at the number on the screen, and I'm going to get you in with another doctor, and let's have someone else give a fresh look at it.
The same number, 499?
Yeah, you can call at 718-780-5863, and we're going to put that number up on the screen for you to see if you didn't get it, okay?
Okay.
Feel better. Now we're going to go to Mel. Hi, Mel.
Hi.
Mel, how you doing?
All right.
Where are you calling us from?
Brooklyn.
Which part?
Midwood section.
Midwood. A lot of diners out there. Caravel?
Caravel is closed.
Closed. I know. I went there the other day. Where can I go? I was hungry. I couldn't even get into Caravel. Where could I go?
King's Plaza Diner.
The best. It's the best one, right?
Best one in Brooklyn.
I just had $22 for like 8 courses, right?
It's unbelievable.
Am I making this up?
But don't go on a weekend.
Oh, you can't get in there. It's an amazing place.
Right. And I love the tax at the end. This way you give a smaller tip.
What can we do for you?
Reticulatasis. ATELECTASIS.
Atelectasis, a lung problem.
Right. Crushed lung. A lot of phlegm coming up. Tough to breathe. Oxygen machine at night. Oxygen walking around.
Dr. Saylor.
Hi, Mel. Are you a smoker?
No. Well, I'm really calling for my wife. She's embarrassed to call out.
It's okay. Is she a
thought
smoker?
she smoked 2 packs a day. Never smoked in her life.
She never smoked?
Never.
Good. Okay, Mel, so atelectasis basically means the lung is not getting enough air. It's either a small collapse or a larger collapse of the lung. A lot depends really upon what the cause is. Most of the times, patients have pain. They don't take a deep breath. They get mucus stuck. So if indeed she has atelectasis, there's something that we have called an incentive spirometer, where she could blow in and hold her breath. That may help. So my advice, Mel, would be to take her to her physician, mention that, and then see, hopefully that'll be beneficial in her case. And I hope she feels better.
Mel, thanks a lot for the call. Good talking to you. We're now going to go to an email quiz, another one. And I guess Alan Minsky is really working the phones tonight. He came back as a doctor. In this iteration, he's coming back with a quiz. First Avenue. Is it First Avenue, judges? Oh, Alan, 0 for 2 so far. One more time, though. Now let's go to Helga. Hi, Helga. Helga.
Hello.
Hi, Helga. How are you?
How are you?
Could you talk nice and loud so I can hear you? What kind of name is Helga?
It's German.
German, a nice name.
Thank you.
Very nice name. What
Well,
can
I'm calling from Manhattan.
Oh, from Manhattan. Is there any diner in Manhattan?
Well, I live in Greenwich Village, so there's lots of restaurants.
What's your favorite?
Italian.
Italian. Which one?
Oh my God.
You ever eaten the Blue Ribbon Bakery?
No.
On Downing, on Bedford?
No.
Oh, it's great.
But still, well, I mean, I don't know. There's so many restaurants.
You think about it. I'll give you a chance to think. What's the medical question?
I have a two-part question.
Okay.
I had knee replacement on August 24th, and I see you have an orthopedic doctor there.
Yeah, one of the best.
I would like to know how long is the recovery. I mean, 6 weeks for me now, and I'm doing physical therapy 3 times a week. Dr. Kastenbaum was my surgeon. And is there a difference between a woman's a plate that they put in the knee or a general?
I think I know Dr. Kastenbaum. I was a resident with him way back when, a very good surgeon.
Yeah.
Your recovery depends on what your ultimate goals are in terms of how much stress you're going to put through the knee. If you want to be very, very active and do a lot of walking and athletic stuff, it's going to take longer to recover. If you're low demand, it's going to take a shorter period of time. So I'll discuss that with Dr. Kastenbaum. In terms of the gender-specific knees, I think it's more a matter of sizing, because a woman's knee and a men's knee is pretty much the same when you get inside there, but they're different sizes.
But they have 2 different things. They have 2 different placements, right?
They have more than one manufacturer of knee replacements.
Right.
About 6 or 7 out there.
Okay.
So
but
when
this
should she be
mainly a
better?
matter of sizing as opposed to gender.
Reggie, when is she going to be better? Feeling a lot better?
Yeah, I am feeling better. It's, it's just that the night is kind of difficult.
Yeah.
My second part was, the question was to the preliminary doctor, is that on the 4th day, they discovered that I had a very, very tiny blood clot in my lung. Now, I don't know if that came from the knee surgery, so they put me on Coumadin, and I'm losing a lot of hair.
It actually is a not too uncommon complication after having major knee or hip surgery. You can form what we call a deep vein thrombosis or a clot in around the knee or calf, and it can spread up to the lungs sometimes.
But this one is in my lung.
Yeah, no, if it breaks off, it can spread to the lungs. They need to be anticoagulated.
Okay.
Dr. Saylor?
Just as a follow-up, that's an extremely common condition. Losing hair with Coumadin, as Dr. Manning said, is not uncommon.
A lot of hair.
Yes, yes. And fortunately, it was found. Sometimes this blood clot to the lung could be a very serious problem. Thank God you survived it, and you should do just fine with it.
Be well. Thanks a lot. Anthony, how are you?
How are you today?
I hear you may know the answer to the quiz.
I hope so.
Okay, let's get an answer.
Fifth Avenue.
Fifth Avenue, to the drum roll. Oh, my God, you're so close, too. Very close. But we have another person, if you just hang on, who's emailing a quiz answer, Geraldine Castagna.
Okay.
She's saying it's 2nd Street. Let's see, you can hang on with us. Let's hear. Whoa, Geraldine Castagna is the winner of this week's handmade, magnificent plaque. What do you think, Anthony? What do you feel?
Good. That's a good answer.
Good answer.
Listen, I got
It's a
one
good
medical
answer.
question.
Where are you calling us from?
I'm calling from Middle Village, Queens.
What can we do for you?
My question is, how do you balance your cholesterol?
Ah, that's interesting. Dr. Saki, how do you balance cholesterol?
Well, cholesterol is a multi-pronged attack, and the strategy really should begin with diet, weight reduction, exercise first. There are a number of drugs, particularly the statin drugs, that are very, very effective in controlling cholesterol. So there are guidelines as to what the level should be depending on various issues, particularly have you had any heart disease. But the focus in the real long term would revolve around attention to dietary control, weight reduction, and eating the right foods. Once that's in place, and the cholesterol is not at your target, then medication should be added.
Anthony, thanks a lot for that question. We're just going to try and get a quick email in regarding a mastectomy. Someone who had a breast removed was going for chemotherapy, and she's having some pains again. She gets sick right after the injection of Neulasta to try and boost her white count. Any thoughts on that, Dr. Saylor?
Yeah, Joan, that is, I'm sorry you're not feeling well, but that's extremely common after the Neulasta injections. Hang in there, you'll get better. Hopefully, as your white blood cells come up, you won't need the injections any longer.
Jonah, yeah, we do wish you well. And I'm really sorry to everybody. We're going to have to expand this show to 2 hours. There's no way around this here now. I want to thank you, though, for watching this episode of Ask the Doctor. I want to thank Dr. Terrence Sacchi, Dr. Anthony Saylor, and Dr. Reginald Manning for coming in tonight. We hope we were able to help you. Remember, it's good to remember you should be proactive about your own health. Speak to your doctors about your concerns. Go for second or third opinions. We'll see you again next week where we're going to talk about heart disease, sleep medicine, and geriatric medicine. In the meantime, please visit our website at netny.net/askthedoctor for my video blogs, the tablet column, podcast, forum, and many more. Now, you can also watch, this is good, you can watch last week's episode tonight at 10 p.m., and you can watch every morning at 10 o'clock an episode of Ask the Doctor. I want to thank Linda Lapatosa, our quizmaster, and I want to thank you all for your questions. Goodbye. Have a safe and healthy week, and we'll see you in the tablet.
Thank you.